Thank you very much. And now let's welcome group, or let's say Startup Idea, Meta 24/7. Please welcome them.
Meta 24/7 is medicine vending machine. Helps patients who want to get medicine at night, or people who live in area where there is no pharmacies nearby, where the machine provides products safely at the location. As the team leader, I want to thank .next for helping me to enhance self-employability.
Hi everyone, I'm Sarah Blushi, marketing specialist. I will present our ideas, Meta 24/7. Our business will indicate the first vending machines in Sultanate of Oman. Our objective is to solve the issue of unavailability of 24/7 pharmacies. Imagine that there is less than 2% of the pharmacies open 24/7 in Sultanate of Oman, where the pharmacy cannot get offered to open a new store and to be open 24/7. Meta 24/7 find the solution by renting the machines to the pharmacies with the all service, high security, and safe environment. Targeting market. We will directly targeting the pharmacies, and indirect we will target general public. Based on our research, there is 4.5 billion customers and 135 companies, pharmacies. They could be our client. We don't have direct competitors because there is no vending machines provide drugs through vending machines. So there is no direct competitors. Okay. About the indirect competitors, we have only 7 pharmacies open 24/7 in Sultanate of Oman. Revenue model. We will take our main revenue from renting the vending machine. About the advertisement, we will add a screen on the side of the machine as a weekly revenue. Sales revenue will take the percentage of sales from the product. Analyzing, we can make like we saw the reports to know what is the demand product on each machine. Our roadmap will pass through 4 stages. First stage, company development. We will seeking one of the investors, one of you, inshallah. Second, beta test, we'll testing the machines. Third will be route out the machines and distribute it around Oman. Fourth one will be being a franchising. We will distribute the machines and we will be as a franchising. This is our website. You can scan the QR if you wanted to know more information about us. Our team of 8 people having a variety of different backgrounds and educations, starting with the CEO, Meitha Al-Yaqoubi, Manal Al-Hashmi, IT specialist, Reem Al-Musalhi, HR, Uhud, she's web developer, Sarah Blushi, marketing specialist, Unood Al-Hasni, pharmacist, Azhar, graphic designers, and the last one, Safa Al-Diwani, she is the technical specialist. Thank you.
شكرا جزيلا سارة. So a quick question to you. Now, when you would speak to these pharmacies, where would these vending machines be located? Have you thought about that on behalf of the pharmacies?
Yeah. There is area in Sultanate of Oman, they don't have pharmacies, or they have pharmacies, but it's not open 24/7.
Yes, that's clear.
Yeah.
Now, like thinking on behalf of pharmacy, where can your client keep their vending machines? Is it in front, outdoors, or indoors, or?
Indoors, it will be indoors.
So indoors, would it be inside malls, inside?
It can be located anywhere.
Yeah, but I'm just trying to match between the problem you're trying to solve, which is 24/7, and if it's indoor, like indoor of a malls are not open for 24/7. So how does it work?
Actually, I think about this point, and we think it should be in a select, in petrol, yeah.
Okay.
So it's open 24
Excellent.
hours, yes, yeah.
No, that's good.
Yeah.
And so are you planning to manufacture your vending machines?
At the first stage, no.
Okay.
We will import the vending machines from company.
So what makes your product special? I can open a company and compete with you guys, right?
Yeah, exactly. We will adding some features to the vending machines. So we are not imported as it is. We will adding a features.
So what's your unique selling point of your machine? What's the uniqueness of your machine?
We will make the IoT report. There will be a report which showed what is the demand project at that machines. So it will be clear, it will make a sense to the pharmacies what they need exactly at that area.
Okay.
Okay?
So, yeah, I get you. I get you. So why won't you skip the middleman and reach out directly to the supplier and you maintain that higher margin? Meaning that you own your vending machines, you operate the whole thing, and perhaps you can get a license to operate this vending machine pharmacy. I mean, it's just an idea.
Yeah, yeah.
If the regulatory part is easy and it's accessible, I believe, and if you have that IoT component in, then there is no need for you guys to maintain the logistic part. The supplier would be notified and would come and fill up these slots in your vending machines automatically.
Okay.
I believe you should a bit move towards
Manufactured, yeah.
Yes, rather than manufacturing. Manufacturing hardware is always an issue. Keep the hardware somewhere else. Somebody else can do it at a much more cheaper rate, and it's maintaining that platform and running it in an automated manner. Yeah.
Yeah. Thank you.
Sarah, يعطيكم العافية. I personally really like the idea. But as Saif has mentioned, maybe you can benchmark what is happening in other countries. مثلا في Dubai, we have smart pharmacy or pharmabox.
Yeah.
And actually they are located in areas مثل universities, airports.
Yeah.
But there's one thing, the pharmacies usually sell over-the-counter medicines.
Yeah.
But even you can also think of, I don't know, having a mechanism with Dakatra whereby you can use the QR to get certain medicines. وطبعاً بيكون في شروط لها. And I agree with Saif's idea. And if you want to go ahead with it, and it's a brilliant idea, you should think of where you're going to locate, or you should own it rather than franchise.
Okay. Thank you.
شكرا على العرض الطيب. Just I want to reconfirm on probably Ghadar's point. How would you control the prescribed medicine in this case? يعني for out of the shelf or out of the counter medicine, this is fine. It's not controlled, but for controlled medicine, how you will resolve this issue? So will you have a mechanism or an interface, as she mentioned, with doctors to be able to allow you to take such medicine out of the vending machine, or you will have probably a digital pharmacist on the location who will confirm certain things. And one more thing is, which is, I think would be very interesting, if you try to probably integrate this with insurance. Nowadays, a lot of insurance pays for medicine. So I think if you can smartly connect this with insurance, this will give you a very competitive advantage and quick accessibility.
Okay.
So any comments on that? Did you think about how to do this operationally?
Personally, we thought as a first stage we will take the medicines without the medicines that don't need descriptions, like basic one, Panadol, adults, so this. Because if we go through the QR codes, our idea in the first stage was we will providing QR codes for any patients will enter, then only they need to scan the codes and get the medicines. But based on the regulation, Health of Ministry, there will be like some rules we cannot implement it. Yeah.
I think it's good, as you mentioned, to go step by step. Maybe, yes, you can prove the model first with out-of-counter medicine, but gradually you can advance probably your solution and be able to get to controlled medicine, I would say, as well. Thanks. No more questions.
Walaikum salam.
Hello.
Yes.
شكرا على العرض. طبعا أنا أجي من background of pharmaceutical and distributor. So if you can get the approval from Ministry of Health to have vending machine has a medicine, I will invest with you. Yeah?
I appreciate. Thank
Yes.
you.
And from my point of view, and from my experience, up to the date, the regulation will not allow it.
Yeah.
However, the idea is brilliant, as they say, my colleagues.
Yeah.
I have looked at it in different way.
Yeah.
And the point of the refilling and maintaining the stability of the out-of-the-shelf products, as I suggested that we should have one unit small van with an experienced, medium experience skills of technical for maintenance, cleaning, and refilling.
Yeah.
So you are creating a job here.
Yeah.
Also, we discussed that it will save cost, save time, save energy.
Energy, yeah.
Yeah. So it will fulfill one of the pillars for Oman in 2040.
Sure.
That's the thing. So if you cannot get the approval for the ministry for the medicine, still you can have the products, consumer products, which will be at the corner of each neighborhood, which again, it's possible.
Possible, yeah.
Yeah. But the temperature and the cooling, so this is an investment.
Yeah.
So you need to calculate your investment based on I mean, how many customer in the neighborhood will be using that place, or how, I mean, you will start a pilot project, for example, in a certain area, and if it's successful, you can then duplicate it into other area. So, okay, thank you.
You're welcome. Any other question? Okay. Thank you.